With talk and coverage about the coronavirus taking over every aspect of our lives these days, we need to keep in mind our heart health as well. This morning, our daytime cardiology specialist, Dr. Shobha, is here to discuss with us acute coronary syndrome. Thank you for being here, Doc.
Good to be here.
Appreciate you being here. Tell us about acute coronary syndrome, symptoms, treatments. Tell us all about it.
Correct. Acute coronary syndrome encompasses a wide range of symptoms. Anything leading up to a heart attack.
Right.
So you may have a lot of chest pain, shortness of breath. And I wanted to bring this up, especially in these times of coronavirus.
Right.
A lot of social distancing going on, people trying to stay home. But shortness of breath, cough, could there be signs of congestive heart failure getting worse? So I don't want people to minimize their heart symptoms in this setting as well.
Right.
That needs to, especially people at risk who've had heart trouble before, who are having new symptoms. Yes, please think about infections, but also please do not forget about your heart. Remember, heart disease is the #1 killer of
Right.
people.
And you're saying acute coronary syndrome kind of is a lead-in to a major heart attack.
Correct.
Or a major incident with your
That
heart.
is correct. Acute coronary syndrome encompasses 3 things. Unstable angina, where you're having new onset symptoms that are getting worse. Non-STEMI, which means you've had a light heart attack. And acute myocardial infarction, which means a massive acute heart attack.
Right. And so treatments, and what you say you're presenting with symptoms, you need to get in to see a doctor immediately.
That is correct. That is
but
correct.
Treatments for acute
That is correct. It's the same as with heart disease.
Okay.
The key is, #1, keeping in mind that that could be a possibility for you.
Right.
And #2 is getting immediate attention for your heart condition. And then, even though it's these times, we may
Right.
still have to admit you to the hospital to get you
Right.
taken care of. I know we are trying to stay away from elective medical procedures and things like that, but in some people, it may not be elective. You may be actually on the verge of a heart attack, and you don't want to ignore that.
Do you think some people, are you concerned that during this time that people may say, well, I don't know what to do here?
Yes.
That there may be some indecision. Should I go to the doctor? I'm having a little chest pain, or I'm coughing, or I'm short of breath.
Correct.
Maybe something, maybe,
Yes.
are you worried about that?
I'm a little concerned about that the patients may be presenting a little bit later
Right.
with their symptoms just because of the concerns and the fears that they have. And those are logical, valid concerns that we need to have about infection spread. But there are, unfortunately, those very people, these are the diabetics that are prone to have heart disease that can have progression of symptoms. And so I just want people to keep in mind about their symptoms as well.
All right. And the symptoms, we talked about treatments. I mean, ultimately those treatments could lead to surgery, and you said that as well.
With heart catheterization or putting balloons or stents, if we have to. But the key is just keeping in mind that you could potentially be having a worsening of your heart condition. And so that is important to keep in mind.
So don't put off treatment simply because you don't want to go to, and that's the other thing. A lot of folks are, I don't want to go to emergency because there's other people there. They may need this more than I do. But if you feel like, if you're presenting with these symptoms, get to the doctor.
Yes, if you think there's something's wrong going on and you've had previous symptoms similar to this when you had a heart attack, please don't ignore your symptoms. One other thing I did want to bring in issue with the supplements that you all just mentioned earlier. And there are some supplements that interfere with heart medications as well. So people need to be careful with their supplements, especially people who are on blood thinners. That can interfere with their blood thinning regimen when they get into these supplements. So it's so important to read the bottles. For example, if you're on Coumadin and you're taking things with vitamin K in it, it could interact.
All right. Great information. Dr. Shobha, thank you so much.
Thank you very much.
Folks, we've got the information for you right there on the screen.